more. But of course, the hashtag is Morning Fix, and we're back in conversation with Dr. Diana Gitau, who is, of course, a medical doctor and also a podcaster, and I would call her a health journalist as well, speaking about universal health coverage and exactly what that is, and SHIF breaking it down. But yes, let's begin with that term, because earlier we posted up a question of the day, and people are like, okay, first of all, universal health coverage, ni. Let's begin from there. Mm-hmm. And is it something that is a pipe dream or doable in your view?
Okay, fine. Let me first start off by a disclaimer. Mm-hmm. I'm not anti-universal health coverage.
Yes.
I'm not anti-government. Mm-hmm. When we grew up, my mom used to beat me. Mm. It was that generation. Yes. And they'd say that, you know what, it's not that I don't like you. Nakuchapa joile makosa.
Nachapa makosa ta si wewe.
Exactly, right?
Yes.
So it's that essence that in us having this conversation, it's not saying that we are not anti-UHC. We all want universal health coverage, yes, right? It's just a few things that we've been saying. We're like, we need explanation here and there, mm-hmm, right? So if we start off by what UHC is, right? Universal health coverage, essentially it's you getting quality care when you need it, where you need it, whether it is treatment, whether it's prevention, rehab, wherever you are, you can get it without enduring financial hardship. You know, those stories of you must contribute before you go to hospital or
yes,
seek any care,
yes,
those stories should be a thing of the past. Not meaning that you'll not pay, so UHC it's not free healthcare. It's just essentially, if you need it, at least you can get some form of it, right? Mm-hmm. So extending the services, extending people who are covered, and essentially the out-of-pocket expenditure
to be very minimal.
Mm-hmm. Right? So that's the concept of universal health coverage, and it's not a new thing, right? So when Kenya comes last year, we say that we are launching this journey to UHC, and we are doing it by these 4 acts, right? And the 4 acts, I think the big one was the Social Health Insurance Act, because yes, that's where there was a money issue. But there were other 3, which was the Digital Health Act, the Facility Improvement Financing Act, the Primary Healthcare Act, and now the Social Health Insurance Act had some funds in it. Mm-hmm. Maybe to explain why the genesis and why it's important to think about those acts is, if you get sick, right, wherever you are, the first facility or hospital, health center, dispensary, doesn't matter. You want to be able to know you can go there, get some sort of care, mm-hmm, and if they are not able to, refer you, right?
Yes.
And have those records to transmit. So it becomes primary health, which is the first step. Digital health, because of that system and transmission and whatnot, mm-hmm, right? Facility improvement is essentially you saying that any money I'm collecting this facility, if I'm missing something, I don't have to requisition from, county and whatnot. If I have some money, I can get it there, right? Mm-hmm. And all that needed financing